Good morning and welcome to our weekly COVID-19 update briefing. As of today, in positive COVID cases within the parish, we've experienced 2,499. That's up 109 from last week, and unfortunately, we've encountered 3 more deaths this past week, which brings our total in the parish as of today up to 85 deaths. As a matter of interest, state deaths as of today are 4,468. As we've mentioned before, Governor Edwards directed recently that we will remain in phase 2 through August 28th, and the reason for that is we simply have not met the federal gating criteria to move from phase 2 to phase 3. According to the Louisiana Department of Health, we have made some progress in northwest Louisiana this past week. It's little, but it's significant. The goal is for states to be 10% or less of positive cases, and fortunately we just barely got under that, so we moved from a red-colored area of concern to yellow, which is improvement, but we're not nearly where we have to be and need to be. Unfortunately, we still are high within the nation. We're at number 5 in the nation in regards to number of new cases. That's serious business. We also have some good news in the fact that our hospitals are in a little bit better condition as far as beds and equipment, and perhaps more importantly, having the staff to work our patients in the hospitals. That's good news. It's estimated that by Labor Day weekend or Labor Day, 7th of September, approximately 40 schools or colleges will be back in session in some form or fashion. And that is an area of significant concern because the young adults and others have become an increasingly large part of the problem through ignoring the protocols for social distancing, wear of masks, etc. The governor has indicated that we're going to be tracking that very closely to see what impact that may or may not have in the near future. There's also some concerns in regard to the national election coming up on November the 3rd with regard to absentee ballots. The governor, the Secretary of State has proposed some changes to the absentee balloting, which the governor does not agree with. And he has indicated that he would, if necessary, veto it, which means it could very well go to court. So it is an issue that will be affecting our populace as we go in to vote on November 3rd during the national election. The governor and all most of the medical facilities, Center for Disease Control, for example, are urging people to get a flu shot this year, worrying about the concerns of the normal concerns we have every year with regard to flu shots, but to have COVID along with that is just very important this year that people who perhaps do not normally get a flu shot should seriously consider it, and they're being urged to do so this year. Again, getting back to why we're not able to move to phase 3, the main reasons remain the same as we briefed before. It's the lack of wearing masks, the fact that many bars and other businesses simply are not complying with the directives that the governor and the federal government has placed upon us, non-compliance with crowd sizes, and non-compliance on occupancy limits in some cases. Businesses are responsible for enforcing these requirements, and that's done through the state office of the state fire marshal, the state office of alcohol and tobacco, and some local fire prevention bureaus. The general policy is that those making inspections will make courtesy visits and point out where businesses are not in compliance, and they will do that twice normally. And the third time they observe something, the business will get some sort of citation or withdrawal of the permit or whatever action is appropriate at that point. But if the violations are blatant or egregious, it'll only be one strike rather than 3 strikes. So it's estimated that some 40% of young people are asymptomatic. But the sad fact is they may not show the symptom, but they may very well still have the COVID virus in them, and they can infect that to other people, their family, their friends, their associates. So it is an increasingly large concern that young adults, 18 to 29, are becoming a bigger part of the problem due to noncompliance. The directives are that everybody age 8 or older should wear a mask, and it is suggested it would be good if children as young as 2 to 7 wear a mask, but that's not directive, that's just a suggestion. So what can we do to save lives and hasten our return toward a more normal economic recovery? Well, they haven't changed, ladies and gentlemen. We've talked about it every week, and I'm going to go over them again this morning. What we should do is wear a mask when out in public. Wash hands, they suggest 20 seconds thorough washing. Cough into the bend of your elbow. Do not touch your face. Disinfect railings and surfaces that are touched frequently. Stay at home when you're sick, and follow the advice of your medical providers. And again, I urge that all of us be a part of the solution, not part of the problem. Regardless of what you may personally feel about the mandate to wear the mask, it is clearly evident that they do save lives and it does prevent the spread of the disease. And if we are to move to the next phase, phase 3, we simply have to comply with these mitigation and prevention protocols. Our next briefing will be a week from today on August 27th. Thank you and good day.